To politics here now, criticism is growing over the Ford government's new pandemic framework. It raises the threshold before restrictions kick in, and some experts, like epidemiologist Colin Furness, are warning it could lead to further spread of COVID-19.
When you ease restrictions, you can expect cases to rise. So it is a putative deal with the devil.
Under the government's new color-coded system, each stage will meet a criteria for restrictions. The red zone, the equivalent of a modified stage 2, which closes gyms and indoor dining, now has a higher bar, which means those businesses can stay open unless there's a full-on lockdown.
In the UK, in France, in Spain, in Germany, I think it's really clear what's happened. They opened up because of economic concerns, and then they end up losing even more when COVID takes over.
Brampton, for example, over the weekend, its positivity rate was 9.6%. And Brampton is part of Peel. It will open up on Saturday, and restaurants will open. Are you comfortable with that?
No, I'm not. It's unacceptable. There's no way that should be happening.
York and Toronto are all currently in a red or modified stage 2. Under the new guidelines, they'll be pushed back to the orange zone, even though the numbers in Peel and Toronto are higher now than when the tighter restrictions began almost 4 weeks ago. Those restrictions will be lifted in Ottawa, Peel and York this Saturday. Toronto will follow the following Saturday.
Speaker, doctors fighting COVID-19 in our hospitals are desperately warning that the Premier is marching us right into disaster.
When asked if he was willing to lower the threshold, the Premier today dismissed the criticisms.
Well, I'm not too sure if they mentioned or if they actually read the whole plan. It's about early intervention to avoid getting to the red zone.
There's no doubt after 8 months, the government is shifting to a plan of existing with COVID and putting more emphasis on keeping the economy open. It's a delicate balance. Epidemiologist Colin Furness isn't against opening businesses, but he says to do so safely, there needs to be strategic testing.
We don't have to lock down. We don't have to close things down. We can test our way out of this.
Furness says frontline workers like restaurant staff and teachers should be tested weekly. The Associate Medical Officer of Health, who called Ontario's COVID numbers very concerning today, dismissed that idea, saying it would cause unnecessary pressure on the system. And while hot zones will be opening up within days as the province continues to see record numbers, the approach appears to be wait and see.
The plan has just come out. We're going to implement it and see how it goes.
Long-term care residents are, of course, among the most vulnerable to COVID. Their cases have been rising, and so have their deaths. In the last 6 days alone, 34 have died.